All right. Hi, Saroj.
Hello, ma'am.
Saroj, what are you doing?
I am traveling.
You're
I am in
traveling.
train.
Okay. Okay, Saroj, you can put your video off. You will get better bandwidth of listening also.
Okay.
Thank you. All right. So thank you, everyone. Thank you so much for being here. And that's to right on time. I totally appreciate being on time because I understand it's 9 and it's a wind up time. Thank you for being here. To begin with, I'll tell you all a 2 minutes introduction about myself without going into much length. I am Kirti Bakshi. I'm a psychotherapist and I'm in the field from 25 years. And I have been in the field of, just a moment. I will have to just put a command here so that. Okay. So I'm Kirti Bakshi. I am a psychotherapist. I've been in this space for 25 years. I've been into training. I've been into personal therapy. I have a consulting room here in Mumbai. I'm Mumbai based. And my journey has been I've done my psychotherapy masters, which actually did not teach me much, but I'm talking about 35 years back. So going back, I'm old enough to be saying I come from a 25 years of experience. So I realized when I passed out, I realized that, the theories that we learn are interesting and they're very insightful, but they do not give us so much of practical handle when we really have to do a climb. And that's when I went about searching that, what all I can apply. When I had a small kid come in front of me for a session, I was quite lost. And I was young also, but I was quite lost. I was relying on all the theory that I had learned, but frankly, the practicals were very few. So I was at a loss of direction. And that's when I started learning. And I learned every possible therapy. I learned CBT, I learned REBT, I learned cognitive, client centered therapy, I learned hypnotherapy, I learned NLP, all the possible things because there's always a curiosity, right? A psychology student will always have a curiosity to learn. However, what I realized was that the true training happens in workshops because, the courses which are 2 hours once a week, 2 hours once a week, they give you kind of a break and they don't give you an immersive experience. When I joined workshops, which were from 9 to 5:36, and I had to travel all the way to town and sit there from 9:30 to 6, I realized that although that was tiring at a point, but it was very, very engaging. It was very immersive. And that's how I started believing in the power of workshops. And I went about looking around for, more and more to learn. Uh, Finally, I signed with hypnotherapy. And after I was learning hypnotherapy, I realized that hypnotherapy is beautiful as a technique, and I started teaching that. I'm literally talking about 20 years ago. I started teaching hypnotherapy, but then I realized the diagnostic tool was missing. And it was then that I came across metaphor therapy. And at that time, I was also holding a part time position as HOD or research psychology. And I happened to come across metaphors in use at a Steiner Institute. And I said, this is very interesting how they analyze pictures and they get to the bottom of everything merely by analyzing pictures. Then I started researching and I found that there's a whole world of metaphors and it is really very, very exhaustive. So, to sum it all up together, what I learned was the following. Number one, there are two schools of psychology. We have the psychoanalytical school of psychology and we have the projective school of psychology. The psychoanalytical school is a Freudian school, beautiful, very wonderful, but did not stand for very long only because it's a little lengthy. And it takes some time for the clients to get their insights. After the psychoanalytical school was very popular, then after a decade or 15 years later, Carl Jung came on the scene, and Carl Jung is the father of projective psychology. And he made a very astounding revelation, and he said, now remember this statement, it's important. He said that the subconscious mind stores information in the form of images. It knows no language. So, if you have to get to the deeper subconscious of the client, go by their images, go by the images they present. These images he called as metaphors. And that's how metaphors came into the world of psychotherapy. You will be surprised to know that Carl Jung was the first person to introduce tarot. Tarot is actually a part of projective psychology. Then there's also a very good book called The Psychology of the Tarot, which is written by Carl Jung. However, the theory and the practicals got separated and divorced, and the practicals continue. And today we see this huge world of tarot reading and angel card reading. Needless to say, they come from the school of projective psychology. So, in metaphors, we have different kinds of metaphors that we use in therapy, in contextual therapy. That is, we will be looking at the drawings that the client presents. They are called as the visual metaphors. Then, when they are talking to you, also, they are presenting to you some very astounding words, very revealing, very potent words. These words are called as verbal metaphors. And then we give them certain imaginary situations, or we ask them, take them to a creative visualization. And that is where they tell us what they visualize, and that visualization is called as an imaginary metaphor. So in metaphor therapy, we have three types of metaphor. So when you join the course and you will be learning drawing analysis from the scratch, taking a drawing, coming to the core issue of the client, and then building it up with verbal metaphor as well as with imaginary metaphor, and then completing your therapy with projective techniques. So now bringing you back to the process of 1 hour session that you have in therapy with your clients. So remember, you have just this 1 hour time to establish rapport, to bring in the faith and win the trust of the client, as well as to make an impact and create insights. So your tools and techniques that you use have to be very, very well practiced. You have to be owning those techniques, and you have to be a master of these techniques. So I'll just mute everyone. There's a noise coming. So in metaphor therapy, like many other techniques, we will be taking you through all the processes, the diagnostic, then comes the developing, and then comes the closure. There are many tools and techniques where we can do the diagnostic very well, but we don't know the development and the closure. So metaphor therapy has a combination of diagnostic, development, and closure techniques all rolled into one technique. It's something that I use very often. I would love to say that it can be integrated with all the other techniques that people have learned. It's very high. And in fact, when you will learn metaphor therapy, you will realize that this is something that is so common that if we had just known this little angle to therapy, we would have probably got more insights into a shorter time. Number one, it creates amazing insights. Number two is the time duration of your therapy is cut short. So when I have a client and I ask them to do a landscape drawing for me, in the first 5 minutes, I am actually talking about the most pertinent issues or concerns in their life. So they feel very understood. Apart from that, it also gives me some things that the client is probably the memory is repressed, they've forgotten to mention it, and the drawing will reveal it. This is as far as drawing goes. Now there can be further repressions. As you understand that the subconscious mind has repressions in layers. So now to go one layer deeper, I will incorporate a projective technique. So I'm going to be teaching you all in the basic metaphor, the drawing techniques, the drawing analysis, the color psychology, the projective techniques, as well as in the advanced, we will be learning acceptance and commitment therapy by the use of metaphors, the verbal metaphor, and the few more closure and diagnostic techniques. This is as far as the course is concerned. I'm sure all of you may have learned something or the other or are coming from some background. Let us now talk about what are the other techniques that are doing rounds of the coaching industry. So how many of us over here are from the coaching industry and counseling industry? Just put a yes, yes, yes in the chat. Coaching, counseling, all those who belong to that background, just put a yes, yes, yes in the chat. It will be great. So, okay. Okay, so we have quite a few. Clinical psychology, Rachna is also from the psychology field, Saroj is from clinical psychology. Lovely. So now clinical psychology also makes use of draw a tree, draw a house, draw a person tests, and they are limited to the psychologist. Over here, the drawings that we analyze are based on nature. We will be using the nature as a reference index, and it will be a more broad-based reference index, and you'll be able to see how we actually reach conclusions. Vani, great. Vani has just joined MA Psychology. Great. So now, metaphor therapy is one tool that I use in combination with all my other techniques that I have learned. I've also had students who have been freshers. Like, they just know that they have the talent and they just needed a technique. You have a need to help people. Your voice, your words matter. People come to you for solutions, and what you say matters to them. You find yourself naturally being drawn towards creating solutions. That means you have the talent. Now, if you combine the talent with the technique, you can become doubly more effective. And that's where I emphasize on the need of techniques, not just metaphor, but techniques are very, very important. Learning a technique, mastering a technique, and working with your clients on technique based progression really produces very good results because it takes away of personal limitations. As a human being, we all have our good days and bad days. But if we are technique based, then we can be very uniform, we can be more productive, more sharp in our work. So, for those who are beginning in this field, let me tell you, mental health coaching is really the need of the hour. There's so much work in the industry. There's so much work. And we are right now at the booming phase. In India, we are in the booming phase. World over, also, mental health is taking priority over everything. So now, from my Google profile only, I have young children like 17, 18 who reach out, and they want to book their own appointments. Earlier, it was parents, who would pause them, but now we have them reaching out to you. And almost every week, I have two, three youngsters who are reaching out for therapy. Also, people have started believing more and more into reaching out to a therapist and seeking help. Yeah. So, yeah, Chandan, I will answer your question. So this is the latest scenario. Let me show you all a slide which will help you all to understand the present scenario of the mental health segment. I have actually muted everyone. Somebody has unmuted themselves. All right. Fine. So are we good to go, guys? Say yes if you're ready to go for a small presentation which will take you all roughly 10 minutes. I'm not holding you all long here. All right. Great. Thank you. Two more minutes and I'm here with you all. So Chandan wanted to know what is the age group suited for providing this therapy. So Chandan, from 2 years onwards, we have analyzed drawings of people who have been as young as 2 years and have got amazing revelations about the family, about the way the children were feeling within the family just by a doodle. We could do a doodle analysis and we could understand, and then we took the parents on. So we've done like 2 years, 3 years. I'm on the panel of many play schools and nurseries here where we regularly visit, train the parent, also help the students understand the students and their psyche. Particularly in terms of disturbed behaviors, we definitely have a look at their drawings. We definitely counsel the parents based on that. So 2 years is the beginning age, and then it is endless. It can be applied to all older and younger people. Corporates, in terms of hiring, in terms of recruitments, it can be used. Okay, so this is the mental health broad categories. Right now, many of us come from an organized sector, either psychiatrists, counseling psychologists, clinical psychologists, and psychotherapists. Now, in the same mental health industry, there's an unorganized sector where you have the healers, the crystal healers, angel, theta, reiki, pranic, and chakras, which is normally energy work, more intuitive in nature. Then you have therapists who are in between the two: hypnotherapists, past life regression therapists, family constellation therapists, cognitive behavior therapists. You have client centered therapy and you have psychoanalysts. And then you have coaches, life coaches, corporate coaches, relationship coaches, personal excellence coaches, holistic coaches, spiritual coaches, NLP coaches. Now, coaches right now is the latest category. It's picking up the biggest certificates comes from ICF, which I think is costing around 3.5 lakhs. And in corporate world, ICF certified coaches definitely command a good price and a good positioning and get more work. But whenever I'm training, I have always in all my trainings have 2-3 coaches who are still looking for, in addition to the beautiful line of life coaching that they learn, they still feel a little short of diagnostics. They still feel a little short of processes. Apart from what they have learned, I've always in all my courses, I've had 1 or 2 ICF certified coaches. So this is how the segment is divided. And it really doesn't matter where you come from. The idea is if you are from the organized sector and you need to learn, the skill is for you. If you are from the healing sector and you want to basically take your healing clients and do a little more work with them in terms of insight building processes, even then the courses are for you. And life coaches, yes, I must say that it's very enriching and very empowering because you'll be able to take your coaching to the next level. So this is how the mental health segment is broadly categorized. So now let's come to what is metaphor therapy that I've already introduced, but briefly, it says it's a study of the subconscious images and how to deal with those images, work with those images, and substitute these images. That is the crux of metaphor therapy. What will you learn? You will learn drawing analysis, color psychology, projective healing techniques, verbal metaphor, imaginary metaphor, letting go of the past metaphor, trauma release, acceptance and commitment therapy, which is the latest therapy nowadays. It's been incorporated as a school of positive psychology, which is picking up a lot more momentum nowadays. Picture strip projections, blob trees, 6 steps of ACT therapy, career choices using metaphor. You'll be learning all this in the basic plus advanced courses. What support will I get after the workshop? So you will be a part of a WhatsApp group, which will be practicing drawings on daily basis, and we'll be providing practice sessions for your group. You will be having senior metaphor therapists who will be a part of the advanced metaphor group and will continuously support your analysis as well as will answer your questions. I will be taking you all up for 1 month. Every day night, I will be analyzing all the drawings put on the group and give my input till you all become experts at it. And also guidance to take your counseling and coaching career forward. So we've had lots of people who've been absolute freshers, and at some point of time, I'll call them probably to talk to you all. They just started off with a need, to reach out and help people. And they started off their journey with metaphor therapy. Today, they have their individual practices. And I'm not talking of one exceptional person. I'm talking about at least 10 to 15 of my students that I know who started this journey. All that we do is we fuel that curiosity, we fuel that talent, we put a technique to it. And then you all are on the roll. I will keep also suggesting to you all what are the other things that you all can do. How will this workshop help me in my practice? It will help you to sharpen diagnostic development and closure technique. It will give you hands-on practice of each process and ability to make your sessions more impactful. Different therapy techniques for different client concerns, like how do you deal with anxiety, will be very different from how you will be dealing with a client who's stuck into the past, will be very different from a client who's stuck with some kind of fear or phobia or has got some kind of a trauma. You will have more confidence in your therapeutic skills. You will have motivation to establish yourself as a counselor, coach, or therapist. You will be able to understand the other modalities more beautiful. Trust me, after you've done metaphor, every other technique comes very easily to you. And you will be able to script your own therapy scripts. What are the other workshops by the counseling company? So we have NLP, master and practitioner level. We teach hypnotherapy, past life regression, child psychology and play therapy, basic and advanced psychology, complete course in hypnotherapy, professional career guidance program, family and systemic constellation facilitator course, relationship, parenting, and self-hypnosis. These are all the courses that we keep announcing from time to time. Metaphor therapy is a regular. And family constellation comes up once in 3 months. The costing and duration. Life coach, if you're ICF certified coaches, you're learning, then it's 3,50,000 to begin with. NLP coaching, from what I have understood in India, is 20,000 to 80,000 from a senior trainer who's an experienced trainer. Hypnotherapy level 1 to 5, because I have been teaching it, so I know it very well. It's 1,20,000 for level 1 to 5. A cognitive behavior therapy from a Beck certification is 75,000 all levels. Metaphor therapy, we have basic and advanced at 40,000. And for when we were doing it in hotels, we were charging 40,000 because we had to pay the hotel charges. But now we have, because it's online, we brought it to 35,000. And we have the dates of basic metaphor course coming up on 2nd and 3rd March, which is a Saturday and Sunday. The advance is on 9th and 10th March, and we'll be following them up for 6 weeks with every week one class of 2.5 hours. The timing on all days will be 12 to 5 with 3 breaks, which is Saturday, Sunday classes will be 12 to 5, and we'll have breaks. We'll have breakout rooms and practice sessions within that. A weekday time will be a weekday evening. Normally we do Thursday evenings from evening 7:30 to 9:30, 10. So now we come to the final costing. Is offline cost was for 45,000, online is 35,000. Discounted cost for March 2024 batch is 30,000. Basic metaphor is 14, advanced is 16. Early bird pricing for those who decide right now is 28,000, and it's not a selling tool actually. It's not that, I want you all to take a call just now. It's just that it facilitates my team on follow-ups. That's about the only thing. You can also pay it in advance and installments. You just have to pay 2,000 to block right now. And this is the GPay number. So you all can take a screenshot of this and take your time. Meanwhile, we'll take up question answers. I'll keep it very crisp and very short. So we're ready for question answers. Has everyone taken screenshots of this? Yeah, guys? Can I proceed? Okay. You wanted to share the first slide. Which first slide you wanted to know? Okay, now somebody has a question.
You told
here.
what is metaphor therapy, no?
What is metaphor therapy? That slide you want to see?
Yes, ma'am.
Okay, I'll show you that. Okay, here we are. So metaphor therapy is about the subconscious mind storing all information in forms of images. And we are going to study those images. They are called as metaphors. Now somebody's asked me a question and I'm going to take up the questions here. Can we do only level 1 or we have to? No, you can do only one level. That's fine. But I advocate you do both. Once you do one, you will be automatically drawn towards doing the second one. That's what I advocate. Art therapy, drawing analysis, all these are the same as metaphor therapy? No, they are not the same, because drawing analysis is a part of metaphor therapy, but it's not a complete therapy. Art therapy is very different. Art therapy is a release technique whereby you're releasing the pent up emotions as an art form, and that's about it. You don't go into analyzing and you don't take it to a therapeutic level, but the release, of course, is therapeutic. So art therapy is wonderful in the sense, like dance movement therapy, it allows you to release. So that's the difference here. So yeah, we have more questions. Can we do only, yeah, that's done. Now we can take live. Can we teach this if we do basic course? No, you cannot teach it because this course is completely trademarked and registered with the counseling company. And when we facilitate a teacher training, you will be able to teach it. So as of today, no, you cannot teach it. So let's take up more questions, friends, and let's just get into a discussion. It doesn't have to be on metaphor therapy. We can take up more questions. We can talk about value system shift that was solved. Can you share the use case? No, it's not only for 2 days, Prachi. It's 2 days to begin with, and then there are follow-up sessions. Do you provide teacher? Yes, we provide teacher training, Chandan. There's something about a value system shift. I'm not getting that message. Baby steps, yes. Okay, Vani, fine. Do you get a certificate? Is the certification associated to a, yeah, certification is from the counseling company, and it is recognized by the counseling company. As such, it doesn't have a government affiliation. It's a technique based course, and that's why it doesn't require government certification. Your Insta gave a teenage value system shift that was solved through metaphor. Can you share the use case? The use case is so there are lots of teenagers who actually start their life journeys with a lot more values, but when they go out and they kind of get lost, they want to reorient themselves. And when they come to us, they're quite lost. And that's where we have a metaphor technique on value system reorientation, where we do use that technique. And with everyone, I think value system reset is a very important part of therapy, where we get in touch with our core values that we have left behind. Okay, guys. Now, all of you who are here and are interested in joining the course, would you be please able to send us a message on WhatsApp saying I attended? So we just have an update on whom to follow up with. Would that be possible for you all to just take up your phones and send a quick message saying I attended? So we can explain to you more. We can share this recording with you, and our team can follow up with you all. So if you all can do that little 1 minute job, it will be really great. And now questions. Please give me questions from any field. It doesn't have to be metaphor therapy. I can answer from the best of what I know. Type your questions or ask your questions. Any questions, guys? Let's talk, yeah. Let's talk about the entire field on the whole. It doesn't have to be only metaphor therapy. So please feel
Hi,
yeah.
I'm Sri Kirti. Can I ask you a question?
Yes, Karuna, please.
Yeah, so for the beginners, you said that if you feel called for, if people come to you for solutions and things
Yeah.
like that, so that calling has been there. People naturally get drawn to me, and I also got feedback, verbal feedback, that when we speak to you, we feel so at ease and things like that. So
Mhm.
I have done my MBA HR and marketing. Later, I did my MSc psychology, but I didn't do it full time. There were some classes of online and some classes offline.
Yeah.
I did my university. Later, I did my NLP master practitioner.
Mm-hmm.
Time and again, nowadays our lives are guided by our social media. So I got called to being a life coach by Pooja Puneet, Success Gyan, and all these things. But I have never been able to find a niche for myself. Like, would I be a good parenting coach or relationship coach or life coach? Time and again, I feel called for, being the coach. And again, there is a fear in me. Um, People share their trauma. And me being sensitive, uh, will I be able to
Yeah,
keep
so
my
that's a very
value?
common question and a very common notion that we have, that when we deal with people's energy traumas and all, do we personally get impacted? Have I understood you right?
Yes, yes,
Yeah.
yeah.
So Karuna, no, we don't, because I'm in this field for almost 25 years now. And day in, day out, I've worked with the rehabilitation center as the head of the counseling department for drug addicts and schizophrenia. It depends again, once again, it depends on your central core. If you are, again, I will not stop insisting on the use of technique. Technique is what is going to take you through,
Okay.
because you don't have to use your own personal energy here as much as you have to use thinking, sharp tools, sharp techniques. Nothing
Okay.
happens. I've never gone for a healing or a clearing meditation or a protective light meditation. Nothing. I've not done anything like that. But it's just simply, logic that you make your eyes, you make your brain like a camera. And with that camera, you're going to see and you're going to find where the fit is going to be. So again, use good techniques.
Okay.
Nothing happens.
Thank-
Please be fearless.
Thank you so.
Yeah.
Thank you.
Most welcome. Anybody else with a question? That was an interesting question. Anybody else with a question, friends?
Yeah, Dr. Bakshi, I did kind
Yes.
of put it on chat, and I think my question is kind of similar, where I'm also trying to see if there is kind of a niche, and I'm still looking for that niche. Now, that niche could be one is, do you want to move into relationship? Do you want to just do individual? So that's one complex state I'm
I
in.
don't think at this point of time you all should look for niches.
Okay.
Okay, so this is for one and all, because you start with a broader base,
Uh-huh.
and then according to your interest, it will automatically shape up.
Okay. So when you have used this particular tool, do I hear you saying that this is mostly a diagnostic? While I
No.
know you did say there's a
No.
develop and a closure also, but can this be used as a standalone for the entire therapy,
Yes,
or do you blend it?
totally.
Okay.
It can
Okay.
be. It can be.
And usually, how do you kind of end up saying how many sessions a person needs if you're using metaphor therapy?
I will tell you that one look at the drawing will give you an idea how much work is required.
Okay, so usually there are multiple sessions.
You can tell a client that I'll need 4 to 5 sessions with you, or I'll need 3, 4 sessions with you, or there'll be times you'll have to tell them this is going to be a little long drawn, so I need a little more commitment from you.
Sure. And Dr. Bakshi, if I can ask one more question.
Sure.
For example, and I'll just give you this example. There is a lady who's approached me whose child is just about 2 years. He's a preemie, and he's having speech delays, right? Now, while they're going to a speech therapist, etc., they wanted to look at energy healing and some bit of coaching. So I'm assuming something like this can help. And if it was you, would you then bring in the parents? And if there is a
I
lack,
would bring in the parents predominantly and work through them.
Through them. Okay, not on the child itself.
Not on the child, no.
Through them.
Child, I would use play therapy, but 2 years is too young for that also. So I would teach the parents, empower the parents on what do I expect them to do on a everyday basis with the child.
So the drawings would really be the parents and not
Yes.
really the doodling
No,
with
the
the child.
The child's also,
Yeah,
but I would route it through the parents.
Okay, got it. Thank you very much.
Most welcome. All right, friends, let's come up with more questions.
Dr. Bakshi, one question from my side.
Yes.
In case the kind of work that we deal with involves a lot of verbal metaphors rather than the drawn ones, the visual ones, is it possible for us to do just the advanced course and the ACT instead of the basic, or?
See, I personally don't have issues with anybody joining any course, but I'm teaching the projective techniques in the basic. So you will be a little lost. That's the only thing. So the continuity would give you an edge in understanding the entire field very well. But I don't restrict people from joining anything that they want.
Okay. Thanks. That helps.
Most welcome. All right, guys, more questions. This is getting interesting. Come up, yeah, let's discuss. It's a good time. I'm here, so any questions that you all have had that have been holding you back, or anything, or any field, doesn't have to be only metaphors.
Hello, ma'am.
Yeah, hi, Priya.
Yes, hi. So I am a teacher right now, and I teach science to my kids. And I have a personal inclination to psychology and learning about it, and also implying it with my students and everything.
Right.
But what I wanted to have is an advice from you that if I do learn this course and I do apply it in school with my students who need it, would that then detract me or make my employers feel that I am kind of inclined more towards psychology, and so I should pursue that instead of teaching my main subject? Like, would it be a help
What's your main
or
subject,
an
Priya?
add-on? My main subject is science.
Yeah. So now what will happen? You can always find a demotivated student. You can find a defocused student. You can take an additional session in terms of motivational coaching. Are you getting my point? So you can become a motivational coach for the students and take a session not on the days that you're taking science classes, but on a weekend you can start your motivational coaching not only with your own students, you can do it with others also and make it as a side thing and then build it up slowly. That's what a lot of my people have done. They are in jobs and they start doing weekends and then they finally give up their main jobs. If you are inclined to do that.
Okay. That's
Yeah.
interesting. Thanks.
Dr. Bakshi, does drawing mean only one type of drawing, like the landscape
No,
you spoke,
anything.
or multiple types, is it?
Anything
Okay.
drawn, anything not drawn, scribbling, doodling, everything.
Okay.
We'll take into account everything.
Okay.
Yes, guys, more questions, more sharings.
And again, I think for me, it's also about energy healing. So anything where you have any examples of your students who may have used the two methodologies together, and is it effective, or do you
All the
advise
time.
to
I myself will be teaching you tools of energy release during trauma release. So that's already incorporated in it. And most of my students are hypnotherapists and are from chakra healing and theta healing background. In theta, when they go up the 7th plane, they do the digging, and that's the time they use metaphor. In family constellations therapies, they use metaphor. And NLP, is largely metaphoric. You've done NLP, so you will know how much they use metaphors.
Okay.
So all energy techniques are largely metaphoric. In fact, when we do fantasy metaphors, it is an energy healing technique. When we do a death closure with a deceased person, it is energy healing. It's incorporated in the metaphor. You will learn it.
Okay. Thank you.
Most welcome. All right, guys. Anybody else? More questions, please?
Good evening, ma'am. I'm Maithili from Tamil Nadu.
Hi, Maithili. Tell me.
Yeah, ma'am. I've completed a diploma in counseling and guidance recently.
Okay.
So, which area will be you can suggest me? First I have to be trained with, like, you were telling so many things like CBT and RBT, and we have come across so many
What
things.
have you completed in your diploma?
So, I've completed the personal counseling, career counseling, CBT, REBT, and on the whole, the basic concepts.
You've
and all
got
we have done.
glimpses of everything, no?
Yeah, ma'am. Yeah, ma'am.
Now you need to master a technique.
Yeah, ma'am.
That's what happened to me. I had done glimpses of everything, but not
Okay.
mastered the technique. You need to master the technique.
Oh, okay, ma'am. So,
Yeah.
which area, you suggest me to
I would
do?
suggest opening your things with metaphor. Not because
Oh.
I'm teaching it, because it's comprehensive and it forms the very basis of many therapies.
Okay, ma'am. Okay, ma'am. Okay,
Yeah.
thank you. Yeah, thank you.
So is there any kind of a thumb rule in terms of Dr. Bakshi, where you feel there'll be X number of hours of practice required to really master metaphor therapy?
So I always tell my students, if you haven't mastered it in one level, please join the course again. And we don't charge you for the next month course joining if you need to repeat.
Okay. So besides the course is enough to kind of master, or
Yeah,
there is
that's
some.
my responsibility.
Okay.
So I'll make sure that you learn it. And if you tell me at the end of it you haven't learned it, I'll take it up and I'll teach you. Don't worry about that.
Ma'am, I have one question.
Yes, Mr. Chandan.
Can we take consultations online with this, ma'am?
Oh, absolutely. Absolutely. It's a no-touch therapy. So you
Okay.
don't need to touch a client. So absolutely online, you can do very good work. In fact, I do 2 clients a day online and 2 clients a day offline.
Okay. So we ask them to draw and we see, we
They
ask
send
them
you a screenshot of their drawing on the phone and you analyze.
Okay,
And
ma'am.
then you
All
take
right.
it forward.
Okay, thank you.
Most welcome. Right, friends? Any more questions? Okay. So we call it a day, and I hope all of you have put the messages I attended. If you haven't, please do so my team can follow up with you all. And I'll hope to see most of you on the 2nd and 3rd. And if you do join us, I'm sure we'll go a long way together. And it's something that you will look forward to incorporating. Maybe some of you are still, a little half-baked as therapists will get fully matured as a therapist. And those who are waiting to begin will mark their beginning of this journey. So I hope to see you all, and good night. And thank you again for being here. Bye, friends.